Hi, welcome back. So in this lecture, we'll cover physical and cognitive development in middle adulthood. So middle adulthood occurs between the ages of 40 and 65 years. Many adults experience changes in their vision starting in their 40s and their hearing in their 50s. There's a condition known as presbyopia, which is farsightedness, and it's the inability to focus the lens on close objects such as reading small print. So this starts to become an issue in the 40s. The ability to see in dim light also decreases with age. So many adults start to have trouble seeing during night, basically declining night vision. And so these are some of the sensory aging changes that we often see in middle adulthood. Presbycusis also occurs. So this is age-related hearing loss, and this becomes apparent in the 50s, and it's caused by natural cell death. While it's caused by age and genetics, hearing loss is also caused by contextual factors. So if adults have a lot of exposure to intense noise over time, this can actually accelerate the loss of hearing. In middle adulthood, skin is the most obvious sign of aging. The epidermis is our outer protective layer of our skin, and that produces new skin cells. The dermis is our middle layer of skin that consists of connective tissue that gives skin its flexibility. And the hypodermis is the innermost layer of skin, which is composed of fat. Women experience changes in their skin more quickly than men do. Around 18.4 million non-surgical cosmetic procedures were conducted in the United States in 2019. Western cultures typically believe that aging contributes to a lack of attractiveness. So there are a lot of individual and contextual factors that play a role in terms of skin change and perception surrounding skin. During middle adulthood, body composition also changes. And body composition refers to the proportions of muscle, fat, and bone in the body. And so after age 40, several changes start to occur. Isometric strength is the ability to hold positions or apply force without movement. This is generally maintained in adulthood. Muscle mass and bone density tend to decline due to a slower metabolism. Bone loss begins around age 40, and this can lead to conditions like osteoporosis. Osteoporosis is a disorder entailing severe bone loss that leads to brittle and easily fractured bones. So there's also reproductive aging and changes in women. So menopause begins at about 51 years of age, which is the cessation of ovulation and menstruation. There is perimenopause, which is the transition to menopause, and it extends approximately 3 years before and after menopause. A shorter menstrual cycle and erratic menstrual periods are the first indicators of perimenopause. Some women take hormone replacement therapy, which is prescribed in early menopause, and this is to address those premenopause symptoms. How women experience menopause really varies with their attitudes and expectations for menopause. So in societies that value youth, women may be scared of bodily changes that occur during menopause. Mayan women of the Yucatan achieve higher status after menopause and generally have more freedom from child rearing. Many women in Western industrialized societies have mixed attitudes about menopause. So there are contextual factors. Like viewing menopause as a disease can affect how women make sense of their menopause. So there's also reproductive changes in men during middle adulthood. The reproductive ability of men declines gradually and steadily over time. Levels of testosterone can shift dramatically in response to stress. And the myth of male menopause refers to the mistaken belief that men go through a sudden dramatic hormonal shift similar to menopause in women. But in reality, men experience a gradual and steady decline in their reproductive ability and testosterone levels as they age, especially in response to illness. Unlike menopause, which involves a clear and rapid end to fertility and menstruation, the changes in men are slower and they're less defined. And so while men do undergo some hormonal changes in middle adulthood, calling it male menopause is misleading because it doesn't reflect the biological and emotional experience accurately. Health outcomes in middle adulthood are closely tied to socioeconomic status. So we find that individuals in higher socioeconomic status brackets generally experience better health. During this life stage, the leading cause of death are cancer and heart disease. There are some recent years that have seen a troubling rise in midlife mortality due to fatal drug overdose, suicide, and alcohol-related liver conditions. Addressing the opioid epidemic requires a multifaceted approach, and this includes both community-level initiatives and personalized support strategies. Cancer is one of the top 2 leading causes of death in middle adulthood. Since 1991, the overall death rate from cancer has dropped by 26%, but it's still pretty prevalent today in middle adulthood. About 15% of adults between ages 50 and 69 are expected to develop cancer. Cancer happens when cells in the body grow uncontrollably. So everyone has some abnormal cells, but cancer develops when the normal controls that stop cells from growing too much are disrupted. And this can happen in 3 ways. So we can have mutations in genes, which are called oncogenes, and they cause cells to divide too much. Some mutations can interfere with tumor suppressor genes, which normally stop abnormal cell growth. And mutations can prevent cells from fixing DNA damage caused by cell division. So all of these 3 ways are which cancer could develop. Skin cancer is the most common. So after that, women are most often diagnosed with lung, breast, and colorectal cancers. Men are most often diagnosed with lung, prostate, and colorectal cancer. Some people with socioeconomic status lower socioeconomic status have higher cancer rates, and this is partly due to limited access to health care. They tend to have a poorer diet, they tend to have more stress, and be subjected to jobs that expose them to toxins. Cancer rates also differ by race. So for example, Black men have higher rates of cancer than Asian American men, and slightly higher rates than non-Hispanic white men. Cancer risk depends on both genetics and the environment. So the rates vary by state due to differences in healthcare, lifestyle, and exposure to risk factors. Advances in science allow us to test for genetic mutations that increase cancer risk. So genetics is not destiny. Only about 35 to 50% of women with high-risk mutations actually develop breast cancer. So other environmental factors like alcohol use, obesity, contraceptive use, toxin exposure, and SES also affect the risk. Women with more genetic mutations tend to develop breast cancer earlier, and it's often before they hit age 30. Early onset breast cancers are usually inherited, and they can be very aggressive and fast growing. Late onset breast cancer is typically diagnosed later in life, and it usually grows more slowly, and it's influenced by aging and long-term environmental exposure. And so although cancer can be very serious, it's not always fatal. Survival rates vary by cancer type, and modern treatments mean more people survive at least 5 years after diagnosis than ever. Cardiovascular disease is the second most common illness in middle adulthood. So about 40% of adults ages 40 to 59 have heart disease. And it causes more than 1/4 of deaths among middle-aged Americans every year. There are some common signs of cardiovascular disease, and these include high blood pressure, high cholesterol, plaque buildup in the arteries, irregular heartbeat, and a heart attack. A heart attack is caused by a blockage of blood flow to the heart, which is driven by a blood clot in a clogged artery. Cardiovascular disease can also cause strokes, which happen when blood flow to the brain is blocked, and this can lead to brain damage, paralysis, and death. Recognizing heart attack symptoms is very critical for survival. So, the most common symptom of a heart attack is having chest pain or discomfort. It may feel like pressure, squeezing, or fullness. Pain can also appear in the left arm, back, neck, jaw, or stomach. Other warning signs can include shortness of breath, nausea, lightheadedness, or sudden fatigue. Heart disease was once seen as a man's disease, but women also have high rates and they often experience different symptoms. So, women are less likely to report chest pain and they're more likely to feel pressure or tightness. They may also notice discomfort in their shoulder, arm, throat, or jaw. They may also experience fatigue, dizziness, nausea, or weakness. Because these symptoms can be less obvious, women are more likely than men to underestimate the severity of their heart attack and have higher mortality rates. The risk factors for cardiovascular disease are family history, age, smoking, and a high diet high that's high in saturated fat is a risk factor. High blood pressure affects over half of adults ages 40 to 59 and about 3/4 of adults over 60. A lot of behavioral factors play a role in the risk of cardiovascular disease. Stress, anxiety, and poor diet can significantly increase the risk. Healthy lifestyle behaviors like getting regular exercise, having a balanced diet, and avoiding smoking can prevent the risk. There's treatment options available, but it really depends on severity. So oftentimes doctors recommend lifestyle changes. There are medications that can help lower blood pressure and cholesterol. In more serious cases, there are procedures like angioplasty or a stent placement, which can open blocked arteries up. Coronary bypass surgery may be needed to replace the damaged arteries with healthy ones from another part of the body. So some treatments are available, but primarily this is a behavioral driven disease. So a lot of risk factors such as poor diet, lack of exercise can significantly enhance the risk of heart disease. Diabetes is another common illness that's marked by high levels of blood glucose. By the age of 65, around 27% of US adults have diabetes. There are several characteristics of having high blood sugar levels. So there's a possibility of having a stroke, circulation problems in the legs, blindness, and reduced kidney functions. So these are all health problems that come from high levels of glucose in the blood. People with diabetes face a range of health problems. So having high blood sugar increases the risk of a heart attack, stroke, poor circulation, vision loss, and kidney damage. Men and women are generally equally likely to be diagnosed with diabetes, but women with diabetes do have a higher risk of a heart attack and stroke for reasons that are not fully understood. Diabetes can also lead to cognitive issues. So it can affect the brain by reducing memory, thinking speed, problem-solving skills, and coordination. Over time, it can speed up brain aging, cause a loss of brain tissue. It can also increase damage to the white matter and increase the risk of dementia and Alzheimer's disease in older adults. Diabetes can also impact mental health as well. So there are some studies that show depression to be linked with diabetes. Depression is 2 to 3 times more common in people with these conditions. And they may experience chronic depression. So up to 80% of relapsing with depression within 5 years. So depression makes it harder to follow diets and take medication, monitor blood sugar. And so having depression with diabetes can lead to worse health outcomes and having a higher risk of death. So many middle adults experience excessive stress. And have the term sandwich generation, which means that they face extra stress as they are caring for both their children and their aging parents while they're managing their careers. And so stress triggers fight or flight. And so it alters our cortisol levels over time after being exposed to chronic stress. And it can raise our heart rate and blood pressure. Now, this acute stressors that don't last very long are not harmful. Stress is a normal part of life. And having a stress response is absolutely normal and helpful. It's adaptive for us. But frequent stress that often occurs from daily hassles can have a wear and tear effect, and it can harm health. Middle-aged adults tend to show higher cortisol levels on days that they care for aging parents compared to the days that they care for their children. Feeling stressed all the time tends to be linked to physical symptoms, poor health behaviors, and lower overall well-being. Long-term persistent stress can contribute to illnesses. Oftentimes, people are more susceptible to colds, flu, high blood pressure, heart disease, and autoimmune conditions. Long-term stress can also increase the risk of anxiety, depression, and trigger mental illnesses like bipolar disorder or schizophrenia. Daily stress exposure is linked to worse long-term health, higher risk of death, and stronger reactions to future stress. Now, many people can respond differently to stress. So some people are more reactive to stress than others. They perceive stress or have higher levels of perceived stress than others. And so how people respond can be programmed early on in life. People that have been exposed to childhood trauma or they live in low-income areas often have stronger stress reactions. People are more sensitive to stress and are at greater risk for negative health outcomes when they score high on measures of hostility and anger. And so there could be individual variability in stress reactivity and sensitivity depending on how personality-wise people are and how they react to those situations and how they perceive them. So more recent research has looked at hardiness as a characteristic and how it affects stress and health. Hardiness means a person has a high sense of self-efficacy. So they feel a sense of control over their life and experiences. Hardy individuals generally approach stress as something they can manage. Social support is also associated with better health consequences and more positive emotional reactions to stress. And so hardiness and social support, coping mechanisms, relaxation, and having good nutrition can all help a person learn how to deal with stress. Daily stress usually declines after age 50, and this is for several reasons. So as people move into the later stages of adulthood, they often gain a stronger sense of control over their life and develop better coping strategies. Many have more stable careers, fewer child-rearing responsibilities, and greater emotional resilience. Additionally, they have social support systems, so friendships and family connections can play a role in reducing stress. And these factors contribute to a more manageable and less reactive approach to everyday challenges. So now we'll cover some of the cognitive changes that happen. So there's fluid and crystallized intelligence. Crystallized intelligence refers to the accumulation of facts and information. It includes a memory of spelling, dates in history. Fluid intelligence is a person's underlying capacity to make connections among ideas and draw inferences. So fluid intelligence declines with age, but crystallized intelligence increases. So an increase in this can help adults continue adaptive functioning. Research on intellectual change in adulthood varies with each study. So processing, spatial orientation, and inductive reasoning peak in the 20s. There are some cross-sectional studies which can tell us about the differing cohorts of people. So cross-sectional and longitudinal studies offer different perspectives on intellectual changes. There was a Seattle longitudinal study that found that there is a decline in perceptual speed in early adulthood, and verbal abilities show gains until a person reaches their 60s. The biological slowing of the central nervous system contributes to the decline in fluid intelligence. When individuals are engaged in complex activities, their intellectual ability can be maintained throughout their adult years. So the more time someone spends reading or practicing cognitive activities and tasks, the more likely they can maintain their cognitive functioning for many years, even into later adulthood. There are some cohort effects in intelligence. So the Seattle longitudinal study showed that intelligence is influenced by generation or cohort. So a cohort would be a person, a generation that a person belongs to. So each generation has unique experiences that shape their thinking. Research that includes Flynn's work has found that IQ scores have been rising over time, which is a phenomenon called the Flynn effect. So, for example, IQ scores increased by about 14 points between 1932 and 1978, which is roughly 3 points per decade. A recent global study confirmed that IQ scores have risen about 3 points per decade. So, from 1909 to 2013, IQ has risen. From 1889 to 1973, the newer generation scored higher in verbal memory and reasoning, but lower in math skills compared to earlier generations. IQ gains have also been linked to historical events. So they were strong between World War I and II, then they dipped during World War II, and then they rose again afterwards, and this was likely due to the effects of nutrition and stress on populations that were affected by these wars. The Flynn effect is seen worldwide, so it tends to be prevalent in developing countries like Kenya, China, Brazil, and Argentina. The increase in IQ is thought to come from better nutrition, healthcare, education, and more exposure to testing. Modern education focuses more on logic and self-expression, which are skills that IQ tests tend to measure. Recent research suggests that IQ gains are slowing in some industrialized countries. Some of them are Norway, Sweden, and Denmark. As living conditions and education improve, IQ scores may plateau. However, studies still show increases of about 2 to 3 IQ points per decade in many countries. And older adults today score higher on their IQ tests than earlier generations. So there are also attention changes with aging. In middle adulthood, there tends to be a harder time paying attention. So we see a decline in attention ability and harder to resist distractions and irrelevant information in the environment. So attention is how well people can focus, divide their attention between tasks, and ignore any distractions or background noise in the environment. And these abilities gradually decline from middle adulthood to older adulthood. There is a classic social cognitive experiment called the cocktail party effect. This is where people must focus on one conversation while they're ignoring another, and then they're asked to provide information. Older adults tend to recall less information and have more trouble switching their attention between multiple speakers. So they find it harder to filter out irrelevant information. Attention also depends on the type of task. So adults perform better on cognitive tasks that involve social cues. So they perform better when they're asked to recognize faces rather than objects. In daily life, changes in attention can vary widely. So experience, motivation, and practice can help people maintain their focus and attention. People that have jobs that require high levels of attention, like air traffic control, tend to show smaller declines with age. When the task involves meaningful or high value information, adults often perform as well as younger adults. And so overall, attention declines slowly and gradually through middle age, and it typically falls between young and older adult levels. Starting in the 20s, working memory capacity begins to decline gradually and steadily. Older adults are less likely to perform as well as younger adults in classroom-like learning conditions, though their knowledge of facts, procedures, and work-related information often increases with age. Changes in attention are closely linked to memory decline. When people have trouble tuning out distractions, it leaves less mental space for them to remember and process information. Middle-aged and older adults often recall fewer words and numbers than younger adults, and their memory for stories also declines slightly. And these differences partly occur because older adults use fewer memory strategies like organizing, chunking, or connecting new information to what they already know. And so for them, it becomes harder to use as retrieving information from long-term memory becomes more difficult. Many memory tests that are used in labs resemble school activities. So this may not reflect how middle-aged and older adults use memory in daily life. They may also be less motivated by these tasks than younger adults. When given more time to process information or reminded to use memory strategies, their performance does improve. Task design also matters. So in one study, younger adults outperformed middle-aged adults on a timed classroom-style test. But when participants studied at their own pace, both groups performed equally well a few days later. And so midlife adults do better when they can control the pace and use their own strategies for learning and remembering information. They tend to perform worse if they're timed and they cannot perform at their own pace. The biggest age-related change in thinking ability is processing speed. So processing speed tends to slow pretty significantly from the 20s through the 90s. So people tend to respond much slower to completing simple reaction time tasks like pressing a button when a light appears. The more complex the task, the slower the response. However, when tasks involve speaking instead of moving, the decline is smaller, which suggests motor speed plays a role. Attention does affect performance. So adults that are easily distracted respond more slowly to processing speed tasks. But when their distractions are reduced, they perform better. Motivation and interest can further improve results. So adults that are more interested in the task, more motivated, tend to perform better compared to adults that are less motivated and interested. These changes are linked to brain aging. So, and studies show that there is a loss of white matter, which are white matter refers to the myelinated connections. This loss slows communication between neurons. And so the loss of neurons forces the brain to form new, less efficient connections. Slower processing speed contributes to declines in memory, reasoning, and problem solving, and this link becomes stronger with age. As people move through midlife, they often gain years of experience and training in certain areas. So this leads to expertise, which is a deep, organized knowledge base that allows them to perform tasks at a very high level. Experts aren't necessarily smarter than others. They've just practiced and learned so much that their knowledge becomes automatic. So expertise refers to this inherent ability and extensive knowledge in a specific area. Their skills are so well developed that they can solve problems quickly and often without conscious effort. So for example, adults are better at tying their shoes than children, but children are better at explaining how they do it because adults do it automatically. Expert behavior is strategic, which means experts think strategically. They know more ways to solve problems and can adapt when something unexpected happens. Even when their memory or reaction time slows with age, they often find ways to compensate, like taking detailed notes or planning ahead. So, for example, experienced pilots and older pilots tend to write down flight instructions more carefully than younger or less experienced ones, and this helps them perform just as well. So this ability to adapt, optimize, and compensate helps experts stay effective even when their processing speed slows. There was a study of food service workers that found that middle-aged workers had less physical strength than younger ones, but they were more skilled, organized, and efficient. And this showed that expertise can make up for the other declines. So we are going to summarize the cognitive capacity changes that occur in middle adulthood. So with crystallized intelligence, this increases over the adult years. Fluid intelligence begins to decline in the early 20s and continues throughout adulthood. With age, adults show more attention deficits. They have more difficulty keeping divided attention and inhibition. Declines tend to vary within the individual and the task that's given to them. Working memory tends to decline from 20s through the 60s. So changes in memory, working memory are influenced by declines in attention and the use of memory strategies. Processing speed declines steadily from the 20s into the 90s, and the more complex the task, the greater the age-related decline in reaction time. And then lastly, with age, most adults develop and expand expertise. Expertise is what helps middle and older adults compensate for declines in processing speed. And so overall, that summarizes cognitive development in middle adulthood.